Hello everyone, thank you for attending today's webinar. My name is Michael Christopher and I'm a sales engineer here at Sweats. So again, thank you for attending today's webinar. Today we're going to take a look at a brand new and exciting tool to Sweats, Decision Support in Medicine, or DSM. As we all know, doctors are very time-pressed individuals, and on average they only can spend 20 minutes with each patient. As a result, when they go to look up information, it has to be concise, authoritative, and specific to their needs. And fortunately, from the ground up, that's exactly what DSM was created to do. It's really a true point-of-care solution that contains more depth of coverage than a bulleted list that some of the doctors may be used to, but also it's more to the point than just a print textbook port to a digital platform. So the first thing I want to do is take a look at the programs that are in DSM. And at the moment, DSM contains 14 distinct programs covering specialities that can't be found in any other point-of-care tool. So, for example, anesthesiology, which is unique to ourselves. And in the coming weeks, there's a number of new programs expected, and also in the coming months as well. Just last week, we introduced the brand new drugs program, and by the end of the year, we'll have programs for hospital infection control, endocrinology, metabolism, and we also have editors working on other programs that you see listed here, such as clinical toxicology, gynecology, imaging, rheumatology, surgery, elbow and spine surgery, sports medicine, veterinary medicine, bringing the total count to approximately 27. And as this content becomes available, you won't be charged or restricted access from it so long as you subscribe to the full package, but we do make individual programs available for sale as well. So what I'd like to do is just take a quick look in pediatrics. And as we all know, the field of medicine is epinemic. So diseases, fractures, medical signs, and procedures are named after the doctors that are closely associated with them. And in DSM, our programs are written by those same big names. So let's go ahead and take a quick look at some of the editors in DSM. So here we can see Dr. Julia McMillan. She's an MD at Johns Hopkins Hospital. She's also a professor and associate dean at the Johns Hopkins School of Medicine. And what you'll notice is a lot of these editors have both the hospital experience, and also they work at the medical schools as well in teaching areas. So coming up next, we have here Dr. Douglas Barrett, MD at Shands Hospital, and also professor emeritus at University of Florida College of Medicine. Just scrolling down just a little bit to give you an idea. Dr. Charlotte Boney, again an MD at Rhode Island Hospital, and also Chief of Pediatric Endocrinology and a professor at Alpert Medical School, Brown University. And then the last individual I want to touch on here is Dr. Douglas Jones, who's an MD at Children's Hospital, Colorado, and a professor and associate dean at the University of Colorado School of Medicine. And if we want to go through and take a look, that was just the editors. But looking at the contributors, what I can tell you is there's doctors from the Children's Health of Atlanta, assistant professors at Emory University School of Medicine, Boston Children's Hospital, Harvard Medical School, Children's Hospital of Philadelphia, and so on. So some of the top names in medicine have written and contributed to the content in DSM. So that way, when you know you're looking in something like cardiology, for example, that area was written by a cardiologist and not necessarily a family practitioner. So what I'd like to do next is use the tool as a doctor would use it. So typically they know the diagnosis that they want to go look up. Maybe they're looking for a little bit more information. And the way you can go ahead and find that information is by typing into the search box. So here, for example, I'll type in asthma. And the first thing you'll notice is that there are various programs that contain the asthma, so chapters. So here we have asthma in pediatrics, or in this case we have asthma in hospital medicine. So the reason for that is because the way that asthma is going to be managed in these different areas is slightly different. So the content is tailored to those individuals. So in hospital medicine there may be a little bit more of an urgent need, so that way for the tests and the management for it is going to speak specifically to that. So we'll go ahead and click on asthma underneath hospital medicine. And by utilizing this side navigational bar, doctors can quickly skip to the relevant areas. And contained within it is chunked text with expert advice, allowing them to really maximize every minute that they have with their patients. So again, going back to that 20-minute window that they have. And the first thing you'll notice down here is it's outlined. So if I wanted to see what every physician needs to know about asthma, I can click it and see. But down from there, there's a lot of other things. So there's the confirmation of the diagnosis. So we have the history, exam, diagnostic tests that can be done. So right here, the management, so immediate and long-term. Going down just a little bit more, we've got the side effects of management, management with comorbidities, et cetera, all the way down. So that way, in case the professional needs assistance at any one point, they can very quickly skip to that area and get the information from the experts that they need to make their point of care decisions. So here, prognosis, patient safety and quality measures, et cetera. And down at the very end, what's the evidence for the different papers that were cited during writing of this particular chapter. And before we go in and actually start taking a look at the content within, I noticed I have a question, so I just want to stop for a second to see here. All right, so far no questions. So real fast, what we'll do is I'll skip to one section. You can see the content that's in there, and then we'll go over some of the features of DSM. So the first thing is if you were to look at, for example, history, so pattern recognition of asthma, you'll notice that there are some chunked text within here, so that way a doctor could very quickly see an area, read it, and then be able to see the different areas that may pertain to the pattern recognition, so history. Going down here, so imaging studies, so what should they order or what are overutilized or wasted tests, so that way they can see that maybe a chest x-ray or CT scan is normal. However, a CXR may be unnecessary for diagnosing asthma unless there's specific complications going on with it as well. Again, short and long-term management, et cetera. In addition to that, what the doctors are able to do is to set up RSS feeds. So down at the bottom, you can see here. So if I wanted to be alerted whenever there's new updates to, say, whatever it is that I'm interested in learning about, so in this case, asthma, I can set up a feed that way on my mobile device. So whether my iPhone, my iPad, it can be pushed to me, and I can read it through, say, Feedly or something like that and receive all of the latest updates. Additionally, you'll notice up at the top there's features such as bookmarks. So if I wanted to refer back to this for later reading, I could bookmark this particular section, or with notes here, I could annotate, highlight, and leave something behind for myself for later reference as well. One of the key features of DSM is that it is accessible. You see here online. It was built for mobile devices in mind, and the authentication can be through either IP address or through referral URL. So simply clicking on a link to DSM, and you'll be fully authenticated. So accessing it is no problem for your users. All right. Well, I wanted to keep things short and brief. DSM is a very simple to use tool. Again, that was really one of the primary purposes of the tool, was to keep things concise. Again, because of that 20-minute window that your users have with their patrons, the doctors. So again, if you'd like to learn more about DSM, I'll include my contact information, or you can contact us at marketing@us.swets.com, and I can also have some of this information made available to you if you're interested in maybe taking a look at the content yourself and establishing a demo or a trial of the product. So again, I want to thank everybody for their time here today, and I hope you have a great evening.